Today, Susan, you had your first treatment with a filler. It was a filler called Radiesse, which is actually, I know we discussed this, it's a cross between a filler and a growth agent. So it does two things. It fills out the lines, which we'll talk about in a minute, but it also stimulates growth of new tissue. So by the time it's worn off, it should have grown more of your tissue, and you shouldn't be going back to zero when it's gone. It's also quite a nice soft product, because we've put it in today, your nasolabial lines, which are the creases that go from the nose to the corner of the mouth, and we've put it in the marionette lines, which are the lines that were going from the corner of your mouth downwards like a marionette, like Pinocchio. That's why it's called that, yeah. You've just had the procedure about 5 minutes ago, so I can see that there's some swelling. So just tell me about what it was that brought you to come to me in the first place for some treatment.
My cousin always comes to see you anyway, and I was starting to notice a lot more lines, even though I'm aging, a lot more lines appearing on my face. But I did have droopiness from a previous operation, and that was starting to show more. So I come in and I had a session with you, and you discussed what you could do. I said that would be, that would help with the droopiness on the lines in my face, the marionette lines that were going down my face. And so I decided to go ahead with it.
Yes, it was it 18 years ago you had a parotid gland tumour, which is that's the salivary gland at the side of the cheek. So during that, some of the facial nerve branches must have been damaged. And you said you were a bit droopy on that side, and that caused the lines on the right to be deeper, didn't it, and more noticeable than the left. Made you look a bit asymmetrical. So what I did today was I put some Radiesse into both of the lines from the nose to the corners of the mouth, and I put some below both corners of the mouth, but I put probably 50% more on your right than I did on the left because of them not being symmetrical. So now it looks, although it's starting to swell, that those lines have gone, and on the still photographs, which we'll also look at, you can see the difference is enormous in the last 5 minutes, can't you? Although you started to get a bit swollen now. Were you worried about it?
Worried at first because I've never had anything like it before. So I was worried, but you put me at ease, you talked me through everything, what you were doing, what was happening, where you put the actual injections, and I was fine.
What were you worried about? The pain of the treatment, or what change would happen?
No, not the change, really. I didn't know, and I thought, would it make me feel sick? Would I imagine that I was going to, or would I have lumps? Would it move? And at the moment, I feel fine. The injections, I never flinched with the injections.
You didn't actually, you were very good, you didn't jump at all. Did you feel the needle going through the skin?
I was going through the skin, but it wasn't unbearable, it was fine. It was just fine.
I did mix the stuff with some anaesthetic, so although you do feel the needle puncture, but which is very brief, it numbs up after that, doesn't it?
Yeah, you don't feel anything at all.
Now when we did this procedure, what I did, because you were nervous about that, was I kept giving you the mirror, didn't I, in between? So put a bit in, show you with the mirror, see what you think, put a bit more in. So we were both agreed on how much went where. And the important thing to point out to people who don't know, the difference between with fillers and Botox treatment is with filler type products, you see the result instantly as I'm injecting, whereas Botox it's 3 to 5 days before you see anything. So what was your reaction when you saw the change?
I was amazed at the difference in it straight away. As soon as you'd done the first injection, and I looked in the mirror, you could see straight away the difference. And I feel it's took years off me anyway, because the lines have gone, and I feel I can smile now without.
Oh yes, because we did a little lip lift, didn't we?
Yeah, a little lip lift.
Because of the drooping on that side, the corner of your mouth were turned down, weren't they, naturally at rest. So I put a little lip lift in, and now they are either horizontal or slightly turned up at rest, so it makes you look a bit happier. As I say, the swelling now is just taken away from that, but as soon as that's gone, that'll look better. So overall, are you happy, you pleased you came?
Yeah, really pleased, and I'll come again.
Oh, great. Well, you were amazing under the needle. You were a brilliant patient, so thank you very much.
Thank you.